Imagine undergoing a surgical procedure in the 1840s. No anesthesia, no painkillers. Can you fathom the unimaginable pain? It's a chilling thought, isn't it? The mid-19th century was a time when modern conveniences such as anesthesia were absent from the operating room. A patient's only comfort was the speed of the surgeon's hand and the hope of survival. Heart surgeries, brain procedures, and other internal operations were performed with the patient fully conscious. The surgical table was a place of unimaginable pain and terror. Picture this: a doctor making an incision into your chest to perform a heart surgery, the scalpel cutting through skin and muscle, all while you're awake, feeling every single movement. Or imagine a cranial procedure, the surgeon's tools scraping against your skull, the sounds resonating in your very being. The reality of the situation is almost too horrific to comprehend. And the tools of the trade? They were far from the precision instruments we know today. Surgeons utilized an array of saws, knives, and trephines, a type of saw used for cutting out discs of bone from the skull. Sterilization was unheard of, and the same tools were often used on multiple patients without a second thought for infection control. The 1840s were a time of brute force and crude techniques, where survival was as much about luck as it was about the surgeon's skill. Doctors were revered not for their gentle touch, but for their speed and strength. The faster the procedure, the less the patient suffered, or so it was believed. While this may seem like a scene from a horror movie, it was the harsh reality of the medical field during this period. We've come a long way since then, haven't we? From the grim, unsanitized operating rooms of the 1840s to the sterile, technologically advanced surgical suites of today, the evolution of medical science is truly a testament to human ingenuity and resilience. The 1840s were a time of medical barbarism, a stark contrast to our current era of medical sophistication. The year 1846 marked a pivotal moment in medical history. The introduction of anesthesia changed the surgical landscape forever. Imagine a world where the only option for pain relief during surgery was a swig of whiskey and a bite on a leather strap. That was the harsh reality of the early 1840s. The invention of anesthesia, however, was about to turn the tides. The word anesthesia, derived from Greek, means without sensation. It was coined by a man named Oliver Wendell Holmes, a prominent American physician and poet in the mid-19th century. The first successful public demonstration of anesthesia took place in the Ether Dome at Massachusetts General Hospital. On October 16, 1846, a dentist by the name of William T.G. Morton made a patient unconscious using an anesthetic called ether. The patient, Gilbert Abbott, was undergoing a tumor removal surgery. To the astonishment of the audience, Abbott reported feeling no pain during the operation. This event, known as the Ether Day, marked the birth of modern anesthesia. Anesthesia's impact on surgical procedures was profound. It allowed for more precise and extensive operations that were previously unthinkable due to the excruciating pain they would cause. Pain was no longer a limiting factor. Surgeons could now take their time to perfect their techniques, leading to improved surgical outcomes. Anesthesia also changed the perception of surgery. What was once a brutal, last resort measure became a more accepted practice. It was a shift from the barbaric to the humane. Imagine the relief of patients knowing they wouldn't have to endure the agony of the surgeon's knife. The fear of surgical pain, which was often worse than the disease itself, was significantly reduced. In short, anesthesia opened up a new world of possibilities in medicine. It offered a beacon of hope, not just for surgeons but for patients worldwide. It was the dawn of a new era, an era where pain could be controlled and surgeries could save more lives than ever before. The advent of anesthesia revolutionized surgery, taking it from a brutal and often deadly ordeal to a far more humane practice. The tools of the trade have evolved dramatically since the 1840s. From rudimentary to refined, these instruments have played a critical role in surgical advancements. If we were to step back into an operating room of the mid-19th century, we would find a variety of tools that, while crude by today's standards, were considered state-of-the-art at the time. There were large, hand-cranked saws for amputations, knives not too dissimilar from those found in any kitchen for making incisions, and forceps that might remind you of a blacksmith's tongs. These tools, often made of iron or steel, were sturdy and sharp, but lacked precision and were difficult to sterilize, increasing the risk of infection. Fast forward to today, and the surgical toolkit is almost unrecognizable. Where once stood large saws, now there are precise, laser-guided scalpels. Where once there were simple knives, we now have endoscopes, thin, flexible tubes with a light and camera attached that allow surgeons to view the body's internal structures without making large incisions. Forceps have evolved into robotic arms, offering unparalleled precision and control. Today's tools are made from high-grade stainless steel, titanium, and even diamond, for maximum durability, precision, and sterility. But it's not just the tools themselves that have evolved. The techniques used to employ them have improved significantly as well. In the 1840s, surgery was a race against time, with speed often being favored over precision to minimize the patient's pain and distress. Today, thanks to anesthesia, surgeons can take the time needed to perform complex procedures with meticulous care. Moreover, the advent of technology like imaging equipment and computer-guided systems has allowed for procedures that were once inconceivable. Surgeons can now view the body's internal structures in real time, guiding their instruments with unprecedented accuracy. The evolution of surgical tools, much like the advent of anesthesia, has transformed the face of surgery, making it safer and more effective than ever before. Today, surgeries are a far cry from the brutal procedures of the 1840s. They are safer, more precise, and significantly less painful. Imagine a world where surgical procedures are no longer a dreaded experience, but rather, a voyage towards healing. This is the reality of modern medicine. It's hard to overstate the impact of anesthesia on surgical procedures. It has transformed surgery from a frantic race against pain and consciousness to a controlled, methodical process. Anesthesia allows surgeons to take their time, to be precise and thorough. It gives them the ability to perform surgeries that would have been unthinkable in the past. But anesthesia is just one facet of how surgery has evolved. Let's talk about the tools. In the 1840s, surgeons operated with tools more akin to carpenter's instruments than anything you'd see in a modern operating room. Today, we have tools that are specialized, precise, and designed with a deep understanding of the human body. We have scalpels that can make incisions so fine they heal with barely a scar. We have endoscopes that allow us to see inside the body without making a single cut. Moreover, we've seen a shift towards minimally invasive procedures. Surgeons can now perform complex surgeries like heart or brain operations through small incisions using laparoscopic surgery. This method reduces recovery time, lessens the risk of infection, and leaves minimal scarring. Then there's robotic surgery, a groundbreaking technology that allows for even greater precision and control. Surgeons use robotic systems to perform operations, controlling every movement from a console. This technology can minimize human error and increase the success rate of surgeries. Finally, let's not forget the role of advanced imaging technologies. MRI and CT scans give surgeons a detailed map of the body, allowing them to plan their operations with unprecedented accuracy. The world of surgery has indeed come a long way from the 1840s, and we continue to make strides in improving patient care and surgical outcomes. From the introduction of anesthesia to the development of robotic surgery, each advancement brings us closer to a world where surgery is not a source of fear, but a beacon of hope. From the unimaginable pain of 1840s surgery to the sophisticated procedures of today, the evolution of surgery is a testament to human innovation and resilience. We've journeyed from an era where surgery was a brutal, often fatal endeavor, to a time where we perform complex operations with precision and ease. This transformation didn't occur overnight, but through relentless pursuit of knowledge and technological advancement. In the 1840s, surgeons operated without the benefit of anesthesia. The concept of pain-free surgery was virtually non-existent. Patients were conscious, feeling every cut, every stitch. The courage it required from both the patient and the surgeon is nothing short of awe-inspiring. The introduction of anesthesia in the mid-19th century marked a significant turning point. It revolutionized the surgical field, making operations more bearable and increasing the range of possible procedures. It allowed surgeons to operate with more care and precision, as they no longer had to hurry to minimize the patient's agony. The evolution of surgical tools also played a crucial role. From rudimentary knives and saws in the 1840s, we've advanced to laser scalpel and robot-assisted surgery. These tools have made surgeries less invasive, reducing healing time and improving patient outcomes. Today, we perform surgeries that would have been unthinkable in the 1840s. Heart and brain surgeries once considered impossible are now commonplace. We've come a long way from the grim realities of the past, thanks to our relentless pursuit of innovation and improvement. However, the journey is far from over. We continue to push the boundaries, exploring new techniques and technologies. From nanotechnology to 3D printed organs, the future of surgery promises even greater miracles. As we marvel at how far we've come, we remain eager for the future of surgical innovation, always striving for safer, more effective procedures that improve patient care and outcomes. If you are new to the channel, subscribe and hit that thumbs up for more content like this one. The evolution of surgery is a testament to our resilience and ingenuity, a journey that continues to inspire and amaze. Thank you for tuning in.